Okay, so I'm going to make a very controversial statement, but hear me out. The best coping mechanism for any cancer patient is avoidance and distraction. I know this sounds crazy, especially coming from someone like myself, but I speak from personal and professional experience. Majority of cancer patients, if not all of them, have some level of self-doubt, fear, anger, just bury themselves into this world of why me. And rightly so, right? Especially, those who have lived very healthy lives and who have done everything right, or what seems to be right, and now they've suddenly been slapped with this news of a cancer diagnosis. So it's very common for all of us to, go back into our past, try to kind of dig deep into where we went wrong, what we did wrong, try to make sense of this diagnosis, try to kind of link it to different kinds of circumstances and episodes and things that have happened in our past that could have and might have been the reason for this diagnosis. The problem is that we remain in that space. The problem is that with every chemotherapy cycle or treatment cycle, every bad day where we are feeling really low and just demotivated, we are then reminded again about our past and then again go deeper into the why me. One of the most difficult things to deal with psychologically with a cancer patient is trying to build out a plan where we help them focus on moving ahead and not kind of reaping and in the sorrow of the past or of yesterday or even today. And while that might be difficult, it's essential. And the best way to do that is by distracting yourself. As a cancer patient, do things that are beyond just your diagnosis and your treatment and your hospital and researching about your disease and then talking about it, and then just worrying about it. There is so much more to life. Go for that walk and don't think about your diagnosis. And I know this is easier said than done, but do it. Listen to, the music that you love listening to, watch the movies that you love watching, hang out with the people you want to hang out with. You don't have to always talk about what happened in the past and what you're going through today. And, if you're someone who's working, then work. Focus on your work as much as you can and, distract yourself from that diagnosis. While it sounds a bit controversial, it honestly is the best way to cope and deal with the diagnosis most times. Consciously distracting your mind to things that are relevant and matter apart from your diagnosis and your treatment and your prognosis and all of that is essential. You will be surprised how much this will help you cope and manage with your diagnosis.